Yeah, you're welcome to another edition of the program Issues. And on Issue, we discuss series of issues. Today, we are going to discuss Health Talk. The program is from your dining station, your favorite station, ABN TV, Houston Correspondent Office, Osogbo, Osun State, Nigeria. With me in the studio today, I have a specialist on pediatrics, and his name is Dr. FUNSO. OLAGUNJU. You are welcome to the program.
Thank you very much.
Okay, who is Dr. FUNSO OLAGUNJU?
Just like you have said, my name is Dr. FUNSO OLAGUNJU. I'm a specialist in pediatrics and child health.
Okay, the topic before us is pneumonia. Doctor, what is pneumonia?
Thank you very much. Pneumonia is an infectious disease. That is an infection. It's an infectious disease that is caused by microorganisms. When we say microorganisms, that means those organisms that we cannot see with our naked eye, and it primarily affects the lungs, which is what we use to breathe very well. That is what pneumonia is an infection of the lung.
Okay. Doctor, there is a lot of misconception about this pneumonia. What exactly the cause of pneumonia?
Pneumonia, like I've said earlier on, pneumonia is caused by organisms, microorganisms. I'm very sure you'll have heard what we call bacteria, viruses, fungi. Those are the various things, microorganisms that cause pneumonia. And in our environment, there are misconception or misinterpretation of what pneumonia is. Some will say pneumonia is when you expose your chest to cold, and then some will put it in our local language that it is otutu aya. And of course, they probably have some little clue about it, but of course not the whole truth, because pneumonia as an entity is associated with cold, and probably that is the reason why those misconception or misinterpretation comes about. So like I've said, they are caused by organisms, bacteria, fungus, parasites, and all that.
Okay. My question now is that who can be affected with pneumonia?
Okay, pneumonia cuts across ages.
Okay.
In other words, it can affect the younger age group, children, it can affect adolescents, it can also affect the adults and even very, very old people. But it's very, very serious when we have it in children and when we have in very old people.
Okay. The other time you are talking about maybe the weather, because you refer to coldness. Is pneumonia really associated with any weather or season, or maybe environment or food?
Thank you very much. Pneumonia is associated with season.
Okay. And
basically the rainy season and also harmattan, of which we are in now. So the prevalence or the how common pneumonia is pneumonia is common now because of the weather condition we are in, harmattan. So pneumonia is common in the rainy season and is also common in the harmattan period. As to whether there is association between of food with pneumonia, well, that has not been documented medically. So about the season, rainy and harmattan is associated with pneumonia.
What of the environment?
Yes, environment, well, environment also contributes too, because if we have a very dusty environment, a polluted environment, that can also increase the likeliness of somebody having a pneumonia.
Okay, Dr. Folusho, what are the means which one can contracted pneumonia?
Yes, pneumonia, like we have said, is an infectious disease.
Okay.
And when we say something is infectious, that means it can easily be transmissible from one person to the other. And pneumonia as a disease is transmitted through inhalation. Inhalation means how when we breathe in and breathe out, and then or when somebody has what we popularly call catarrh, okay, and all that is the organism that causes pneumonia is found in the air we breathe in. So, and if we now have a contact with somebody who is already having pneumonia and the person cough or sneezes and we are nearby, we can easily inhale that organism through the air, and then if care is not taken, that person can also have pneumonia. So it's basically through the breathing in of air that is already infected with the organism that is causing pneumonia.
Okay, what are the factors of pneumonia?
The risk factors, especially in children.
Okay.
When babies born with low birth weight. Okay, what do I mean by low birth weight? When a baby is born, we expect the baby to be within the range of between 2.5 and then 3.5. So when a baby is born less than 2.5 kilogram, we'll say that baby is a low birth weight baby. So such babies are at risk of having pneumonia. Also, babies with congenital heart diseases, they are also at risk of having pneumonia. Also, environment, like we said earlier on, environment, polluted environment, both inside and outside. For instance, those that cook with firewood, the smoke emanating from all those cooking, even stove, so can make a child or somebody to be at risk. Also, smoking, especially in older children, adolescents, and adults. If there is somebody that is smoking and you are nearby, the person smoking is at risk of having pneumonia, and the somebody who is just by the side of the person that is inhaling that smoke as well is also at risk of pneumonia. Also, the dust on the road, the dust inside the house.
So without taking without smoking now, someone can contact it?
Yes, without smoking. If we are in a polluted environment, and pollution, there are so many things that can cause pollution. Dust, smoke here and there. And then, you know, smoking is a form of pollution. So the person that is smoking is inhaling the smoke, whereby the person also that is nearby, the person is not smoking but is just perceiving the smell. So that person is also at risk. So risk factors are those things that not necessarily the cause of pneumonia, but when those things are around, they can also increase the chance that somebody will have a pneumonia.
You know, some people during the harmattan or coldness weather, they would like to smoke because they will say that they want to even let their coldness to leave them. So what is your take on this?
Well, smoking generally, as far as health is concerned, and as far as what we are discussing is concerned, can increase the chance of somebody having a pneumonia. And it's not just pneumonia alone. Infections along the tract, the respiratory system can occur. So, well, for those that are smoking, that might be their own reason for smoking, but medically, as far as pneumonia or infection of the respiratory tract is concerned, one is at risk of pneumonia, and then smoking can also cause some other things.
Okay, if you are just joining us, the program is Issues from ABN TV Hosting and from its correspondent office, Osogbo, Osun State, Nigeria. With me, I have Dr. FUNSO OLAGUNJU. The program continuing just in a moment. Okay, you welcome back, Dr. OLAGUNJU. So, what are the symptoms of pneumonia?
The symptoms of pneumonia, there are 2, 3 or more symptoms, of which catarrh is one of them. That's nasal discharge, popularly called catarrh, cough, then fast breathing or difficulty with breathing, then fever, and other things might also follow. Maybe in some children, very young ones, they may not be able to feed very well, they may be vomiting. Of all these things I've just listed, the one that is of paramount is the breathing, the fast breathing or difficulty with breathing. That is one cardinal thing that if one sees it, that this person is likely to be having pneumonia.
Okay, what do we do if we perceive or see someone having the signs or symptoms of pneumonia?
Well, the best thing to do is to take the person to the nearby hospital, okay, where there are doctors or specialists that will take care of the pneumonia. And when they get to the hospital, they will take the history, what happened, and the person will be examined very well. And after the examination, investigation will also be done, a chest x-ray, full blood count, and all that. And after the person has been adequately examined and investigated, then treatment will commence. Like I've said earlier on, okay, that when somebody has pneumonia, what do we do? The person should be taken to the hospital, okay, where a doctor and experts can take care of the person. And what do they do when they get to the hospital? Okay. There are questions that will be asked from them. There are questions that will be asked, and such questions will include: when did you start noticing these symptoms, cough, fever, fast breathing? And after a thorough questioning, which we call history, has been done, then such person will also be examined. And where do we examine? We examine from the head to the toe. We also examine the respiratory system, of which we are talking about the examination of the chest. So, and during the examination, there are some signs that will be elicited. So, they will be examined very well, and then after that, we do investigate the person. And how do we investigate the person? We do a chest x-ray. So chest x-ray is a film that shows the section of the respiratory chamber. Look at it, are there problems with it? And after that has been done, some other investigation like blood test will also be done. We call it full blood count. And then summarizing all this together, then we will now determine what we are going to use, the kind of drug that we use. Most especially we use antibiotics, and then there are different classes of it. So what will be suitable will be used in the hospital by the doctor, and then treatment will commence. And the duration of the treatment also depends on the kind of organism the doctor think, or probably during the investigation detected. And also, will the person stay in the hospital? That's another question. Yes. Now, what determines whether the person stay in the hospital or not? We usually have some, especially in children, we have some criteria that we use. If the child is less than 6 months of age and we've examined and we know this is pneumonia, that child will need to be admitted. And then then intravenous antibiotics will be used to manage such child until the symptoms and signs disappear before going on. Then also, if there are evidence of complication, like if the child is in heart failure, children when they have pneumonia, they usually, if not treated on time, such pneumonia are complicated with heart failure. It can result into heart failure. Thank you. So, and if we have features of that or signs that is pointing towards that, that child must be admitted and be treated accordingly. Also, if there are signs of that are showing that the level of oxygenation, what I mean is we breathe in oxygen and there is a way we read the oxygen level in our body, and if there are signs of desaturation, we call it desaturation. Okay, and we usually use a pulse oximeter to check that. So, and if it falls below certain percentage, especially if it falls below 90%, that child require oxygen, additional oxygen apart from the one is breathing in. So we give the oxygen. That child, we have to stay in the hospital. And then if probably during the course of the illness, maybe the mother has been buying one antibiotics, as in the oral antibiotics, oral drug, and the child has used it for some days and is not working, that child should come to the hospital, will be admitted. And if, because there are situations where people comes to the hospital and doctor may not have that assurance that, okay, if I'm allowing you to go home with this child or with this person, you are not likely going to take care of the person very well, maybe because the caregiver is not in the position or cannot take care of the person properly at home. Then we will have to let the person stay in the hospital, where the doctors, nurses and everybody will have to monitor the person very well, because like I've said earlier on, pneumonia is a very dangerous disease, and if not properly catered for, other things can follow and it can even lead to death. So we don't joke with it. We don't even pray for that at all. So those are the things that we do in the hospital to take care of them.
Okay, pneumonia, is it treatable?
Yes, it is treatable. It is curable.
How?
What we use to treat is antibiotics.
Okay.
And like I've said earlier on, the different microorganisms that are causing pneumonia differ. Some are bacteria, some are viruses, some are fungus, and some other one. But the common one, the viruses and the bacteria. So we use those medications to treat. It's treated if well managed properly and then on time. It's treatable, and once it's treatable, the person gets treated. Those things, those risk factors that we've said earlier on, the person stays away from them. So that's it. So it's not as if it's something that can be coming over and over and over. It could come if the person does not avoid those risk factors. But once you are able to avoid those risk factors, pneumonia is a treatable condition. Yes.
Okay. If a person with pneumonia is not treated on time, is there any complication that can arise?
Yes, especially in children.
Okay.
If pneumonia is not treated on time, it could be complicated with heart failure. That means the heart is failing. The heart is not doing its function very well. That's how I can put it. So that can follow a pneumonia that's not properly treated, or late presentation. When somebody has pneumonia and is not getting to the hospital on time, that can all cause it. Then it can also lead to what we call pleural effusion. Pleural effusion is when there is water, in quotes now. We can just to come to the layman language, accumulation of fluid in the chamber of the respiratory system. So that can follow a pneumonia if it's not properly treated. So those are the few common ones that can arise as a result of complication, as far as complication is concerned.
Okay, thank you very much, Dr. OLAGUNJU. What is your advice? What is the advice for the people, most especially those who are already affected with pneumonia?
Yes, like we have said, once we notice signs or symptoms that has to do with pneumonia, cough, catarrh, more importantly fast breathing, let the person come to the hospital and then the treatment follow. Then another key thing that we need to do is, how do we prevent pneumonia? Pneumonia is a preventable condition, is a preventable disease, and in talking about pneumonia, health education is very, very, very important. This program is a form of health education. So that is the first thing to be done, health education, in which we talk about pneumonia, we talk about the risk factors that are causing it, how to prevent or associate ourselves with all those risk factors. Then another aspect of the prevention is what we call specific protection, and what that means, example of that is immunization, especially in children.
Okay.
Immunization is one of those things we do under specific protection, because a child that is well immunized is not likely to present with pneumonia if all other risk factors have been properly checked. So because in the timetable of our immunization, there are vaccines that helps in preventing pneumonia. That is what we call Haemophilus influenza vaccine. We call it HIV, type B, HIV, Haemophilus influenza vaccine, type B vaccine. So Haemophilus influenza can cause pneumonia. So once a child is immunized against it, that means if a pneumonia is coming and the organism that is going to cause that pneumonia is H. influenza, that child will not have it. So there is also, as part of our routine immunization, there is what we call the pneumococcal conjugate vaccine, popularly called PCV by our mothers at home. So that also is also one of the vaccines that is taken to prevent pneumonia. Measles can also cause pneumonia. So a child that has or well vaccinated and immunized is not likely to have pneumonia, considering other factors, if other factors has been put to check. So immunization is very important. Then for children, breastfeeding is also very, very important. Exclusive breastfeeding will say, that is, breastfeed your child for the first 6 months of life. Then after the 6 months, you start complementary feed, pap with soya milk, pap with crayfish and all that, while you still continue the breastfeeding. And for us,
in our local area here.
yes.
Okay.
So, and for us, in this environment anyway,
Okay.
and for us, we usually, for pediatrician, those that take care of children, we usually say mothers should breastfeed for 2 years.
2 years.
Yes.
2 good years.
Yes, yes, because of the importance that is attached to breastfeeding. That is what we practice, and that is what we encourage in our own environment here. You know, we are talking about prevention. Another level of prevention is early presentation in the hospital and early diagnosis. Because sometimes, like I've said, the symptoms of pneumonia, fever, cough, catarrh. So there are no specific symptoms that is attached to pneumonia. All those things I've mentioned, they can also be present in some other diseases. In fact, malaria can also present that way. But if one is able to present early into the hospital and then a diagnosis is made, diagnosis, what I mean is that we actually immediately we find what is causing it and then we treat appropriately. That's another level of prevention. So we also encourage that. And then another level of prevention is how do we limit complication, disability that may arise from pneumonia. One of the complications that may arise is heart failure, especially in children. So we need to treat the heart failure with the kind of medication that must be done on time. And then the last aspect of prevention is what we call rehabilitation. Okay, sometimes a child may present late to the hospital, complication might have set in, and then there are things that we cannot bring back to the normal self. So such a person will require rehabilitation. Some might need just physiotherapy. So it could be as bad as that. But of course, we should not wait until we are getting to that aspect. And I believe this program is also one of the prevention means of pneumonia.
So we should not wait till we reach complication area.
Exactly.
Thank you very much. It has been nice. It has been interesting having Dr. OLAGUNJU on the program Issues for today. And let me release Dr. OLAGUNJU. You are very welcome to the program once again.
Thank you very much
for coming.
Here
we wrap it up on the program Issue for today, brought to you from ABNTV Hosting Correspondent Office, Oshogbo, Osun State, Nigeria. My name is Bukola Oloshola. The man behind the camera is Tosin Adedokun. And a big thanks to the producer of the programs, Ayo Salako, and executive producer Eldapo Arowolo. Until another time on the program Issues, I say bye for now.